everyone.
Morning.
Sorry for the tardiness. We were next door. We got about halfway done with the tour, so we're gonna try to do something again next month to finish it off. But let's get this started. The first order of business is to approve last month's committee meeting minutes. Motion made by Supervisor Strauss, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried. Okay, we have Chris from Employment Training. Take it away.
Thank you. I jumped in first because I only had one item, and that is request authorization to fill a vacant position. After 26 years of service, our senior counselor is retiring in July, and the goal is to promote one of our current counselors who has even more experience with the county into the senior position, and then backfill the counselor position.
Okay. Get a motion to get that on the floor, made by Supervisor McDevitt, second by Supervisor Frazier. Any discussion? None? All in favor?
Aye.
Opposed? Carried.
That's all I had, thank you.
Okay. We also took a nice tour of Chris's place a couple weeks ago, and we were just talking about it. They had a couple of conference rooms over there at Social Services, but will you be needing those as much now, because now you have the availability for the second floor to host?
We use our conference rooms quite
Okay.
often, yeah.
No, very nice.
Thanks.
Thank you.
That's it?
Yeah,
All right. Thanks, Chris.
yeah, thank you.
Okay. Oh, there she is. How are you? You're up, Denise.
Come on, right up. Sure. Oh, this is the original. Can you give the original?
Give it to Sarah.
Chairman, thank you.
There
we go.
Okay. Beautiful. Thank you.
Good morning.
Thank you.
Thank you. Yep, I'm good. Do you have one question? I do. Well, that's all set. Okay.
Whenever you're ready, Denise.
Okay. So, absolutely. The first thing on my agenda, I had some leftover vacation from 2015 that I'm looking to have paid out. So I do believe, at this time, I'm looking to have the money transferred, and in the packet is the resolution for that.
Denise, didn't we just
I'm a little confused.
We did this the last time.
Yeah, but I think I had to actually ask for the okay,
She
thank you.
didn't have the source of funding
There you
to
go.
fund this.
Oh, okay.
That's what I'm looking
Okay.
for.
Okay. So are we still looking for it?
Yes, I do believe so. It looks like it has to come out of the contingency fund. I had a discussion with Rob Lynch, and he said it would need to be transferred out of there. And the breakdown for that transfer is on that third sheet there.
Okay.
And then, and the account numbers, GL accounts of where that money would be distributed.
Okay. It's okay with Rob. How about
would be-
Chairman Garrity? Or do we have to move it to finance now?
That would be moved to finance. That would be their decision where the money comes from.
Okay. So we can just move that on to finance if that's okay with the committee. Motion made by Supervisor Strauss, second by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried.
Thank you. Next item on the agenda is, in-state travel. Every year I go to the New York State County Veteran Service Officer Conference in Sherrill, New York. I do ask for a fleet vehicle, and this year I believe the per person rate, and it includes the meeting and the, lunch that they serve, is $32.50.
Okay.
There is no other cost involved.
Okay, motion made by Supervisor Simpson, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay. And last on my list here is, some research that Cindy's been conducting, and I'm actually gonna turn it over to Cindy. We're looking to start a Facebook page. I think we're missing the ticket on reaching our younger veterans. My website just isn't doing it, even though it's very extensive if you've been on there. I do have and have received compliments on it, but I do believe we are still missing, a good population of the veterans due to that. And if Cindy wouldn't mind, she's really the guru in this area, so I'm gonna let her talk on the Facebook.
So we've included, a one-page, just a little rationale, what we're proposing and why, what the goals are. So as Denise said, we are looking to be able to post and share information real time, hopefully reach out to a larger target audience, most younger veterans, and even older ones nowadays. Everything is through social media, you know, I'm sure all of us are aware of that. They want access as fast as possible on a mobile device. They're typically on their phone or a tablet, and they're looking for information. The research I did, there are approximately, and this was just a very quick, just to see who else was using social media through a veteran's office, there's approximately 10 to 12 counties in New York, including the New York State Division of Veterans Affairs, Saratoga County, Washington County, and there's others, that's not listed on here, that have current Facebook pages. Most of them are fairly active. We would like to join in that so that we can post our own information. A quick example would be the red van is used for the honor flight. It would be great to take pictures and, you know, promote the agency, promote the services that, you know, Denise provides. Share information that comes out through the VA. We've listed some sample posts on the bottom of that first page. As far as administering the page, we would like Denise and I to be administrators along with IT, obviously, to supervise so that we could have creative control as to how it's created and what we're posting.
Supervisor Seaver?
You bring up a very relevant point, and just last month, we've been having a lot of discussions about developing a policy not only for social media, but for departments to be able to have Facebook pages, as well as Twitter and Instagram. We've been in communication with our county attorney about it, and this issue arose recently with the department, or with the Board of Elections. And I think what we had informally decided with the county attorney and the county administrator was that pending a policy that Supervisor Leggett and I are working on, and if it's the pleasure of the committee, if it's fine with you, is to allow our department to go ahead, set up those pages, you know, just notify the IT department to let them know what's happening so we can keep track of what departments do have those Facebook pages. And then in the near future, you'll see us roll out a policy about it. But we didn't want to hold up anybody being able to develop these pages, recognizing how important it is to get out to those types of demographics. So, did I give that right, Brian?
That's my understanding.
Okay.
And
So
I
if
just
that
wanted to throw
answers your
something else
question.
in there, Supervisor Seaver. Cindy, if I'm not mistaken, has a degree and has worked previously in this type of field, so.
My background.
Yes, her background is in,
Digital media?
not social media, but.
No, back prior to children, honestly. I have a math and computer science degree.
Oh.
So I
So
am, and I
she-
do maintain a few other pages. One of my husband's, he's self-employed, and I do maintain a few other pages.
Well, maybe I'll reach out to you then. I know Craig and I are just, you know, kind of on the beginning parts of putting this policy together
Yeah,
and working with
I
Mike
would
Coleman.
love to do that. I always find it good to, you know, like, particularly with veterans, like, you know, really to address and educate the audience and engage the audience so that if somebody doesn't even know this office existed, the first thing they're gonna do, honestly, is get on social media.
I think as a county, we've missed the boat a little bit with social media, and we've taken some trainings down at NISAC, Craig and I both have, and are looking forward to moving the county into that direction of social media. But in the meantime, we just didn't want another layer of government where you'd have to get another approval and put it in a form of a resolution to have a Facebook page and then go back and change it. And there's just no reason to wait months to be able to start a Facebook page when you can get out there and be helping people right away. So,
And that's ultimately what the goal is.
yeah. If that's okay with the committee, they can just set it up until we
Yep.
get this policy
Yep.
rolled out.
Okay.
Great.
You just have to be in touch with Mike.
Oh, absolutely.
Okay.
All right, thank you.
And lastly, the last page there, I just wanted to give a brief overview of how the department is, moving forward into, this generation as far as our file management and everything. So, A few years ago, we implemented a system called VIMS, the Veterans Management, Information Management System. To date, we have 371 active recorded files. So if one of those people come in, I no longer have like this huge paper file on them. Everything's propagated through this electronic file. It's easily printed, things are easily changed, nothing's missed. And out of the 24,000 files that we had, when I started here in 2008, we're now reduced down to 865 active files, so physical files. And the discharges that were in the other couple hundred, or whatever thousand, we have saved those discharges, and Cindy right now is working with the National Personnel Records Center out in St. Louis, Missouri, to archive and preserve those records, because our office is really not a record retention facility. God forbid we have a fire or something, those records will be lost forever. So she's working with them to preserve those records and reduce our papers within the office. And we can always retrieve those papers from them later on down the road if we ever needed to. I just received a phone call the other day. In the past, New York State Division of Veterans Affairs used to have a satellite office out of our office. They also allow a state grant of $8,625 or something like that a year for the work that we do. We wish it was more, but it's not right now. And they're looking to come back 2 days a week. I think it's more of an outreach for them. I think what their plan was when they moved to ACC was to attend to all the veterans that were discharging that were going straight to school, and now that's kind of plateaued for them. So they're looking to get back out into the community, and one way would be to come to my office. So they'll be there, I believe it was Wednesday and Fridays, starting September 7th. We don't have an issue. We have available space for them, so we welcome them coming in. It certainly helps feeding, information off each other to try to figure out how to make sure that a claim gets resolved, and it's a good resource. So for right now, that's their plan, and we welcome them back into the office. And very exciting, in the near future, I will be doing some web-based training with the VA directly. I have to get security clearances and fingerprinted and everything, and they'll train me on these web-based products to both electronically submit and properly manage my current claims right from my office, but from their systems. There's no cost to the county. It's just my time and energy for the training. It's pretty intensive, and we're looking to start that hopefully this fall. And finally, I want to extend appreciation for, I don't know if I was one of the first departments, but whatever it might be, the new vehicle, the veterans love it. It is a very good asset to the department, just cost effective and comfortable for them, and it's just worked out very, very well.
That's great news, good to hear.
And that's all I have.
Thank you.
I can't, if you guys are coming over, again, you're gonna finish out your tour, we look forward to seeing you then next month. Okay?
Very
All
good,
right.
Denise, thank you.
Thank you.
Thank you.
Harriet, we're gonna have you come up first. Christie's not here from Office of the Aging, but can we have you come in before Public Health, please?
I don't know if you have a copy of our.
Thank you.
I have one. Okay.
Okay. I'm Coordinator of Services for Office for the Aging. My name is Harriet Bunker. Mrs. Sagal couldn't be here today, so I just want to quickly say one statement that she asked me to read first. Because of the changes that she's proposing.
Harriet, you could sit right at the table if you would like.
Please stand it. Okay. because of the changes that she's requesting, it's to combine, the managerial, responsibilities of the coordinator of services and the nutrition coordinator, and then add a specialist title to assist with some of the responsibilities that do not need to be done by the coordinator themselves or herself. So that the number of staff would stay the same in our Office for the Aging, and she would just be eliminating the coordinator of services. She'd be combining two coordinators' positions together. And this would give us an extra specialist for that position. It would save the department money, and she believes it would, improve workflow. It's also a good time because the specialist test was held in April, so we could be, she could be hiring from that civil service, test.
Right. Okay.
Just make a motion, yeah.
Okay, well, we have to do,
The first resolution there,
right,
request to, create and fill a position.
okay, and we've heard the rationales for these, so, Supervisor McCleary, do you wanna move all
Yes,
items?
I'd like to, yes.
Okay, do we have a second? Second by, nobody?
I
I'm active.
Oh, I'm sorry.
Yes.
Second by Supervisor Simpson. Discussion, Supervisor Seeber.
Thank you. Were these part-time positions combined into
No,
one?
these
or
are all
they were
full-time
full-time?
positions.
Okay.
And since, actually, I'm the coordinator that's retiring at the end of this month.
Congratulations.
And,
Oh, great. Congrats.
for 20 years, but I love the office. But anyways, the whole thing is we have 3 coordinators. We have, coordinator of services that I did. We have a nutrition coordinator because we have so many meal sites between Warren and Hamilton County, we're 2 counties. We also have a New York Connect coordinator. And it's basically getting rid of the position that I have, but just not really getting rid of it, combining it with a nutrition coordinator, so that there's somebody overseeing what's going on in the office, plus she's still doing the nutrition. We still need a specialist. We still have 3 staff people that do services through all the other programs. So we're actually getting rid of the coordinator and having 2 specialists and an aging services assistant. We still want us to keep the same number of staff, but it's just combining one of the coordinators. She could still do the nutrition program and then just coordinate our services within the office. So
Right.
just one less coordinator, one less, chief.
Right.
Couple more additions.
Okay, any other questions or comments? Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried. Okay, is that it, Harriet?
Okay, does that take care of the second resolution, is a request to fill a position? That's for the specialist.
We did all 4.
That's all? Okay.
Did all 4 of them.
Okay, very good. Then the third, request is to ratify actions of the chairman in executing a contract with Canales Grinding Services.
Okay, so we do need an amendment though, because this is ratifying action of the chairman, so would you like to put that into your?
Yes.
And Supervisor Simpson, you're okay with that? Okay. All in favor?
Aye.
Opposed? Carried? Okay. And we're all good with 4 then as well?
You're all done? Board's okay?
Yeah.
Very good.
Anything else, Harriet?
No.
Thank you
very
for
much.
stepping
Made
in.
it easy.
What do you mean, Matt? 3 and 4 went?
Which we really shouldn't.
The elks and the knife sharpening?
Well, that was the motion.
Put everything together.
We put everything together.
Oh, well, I'd like to disclose I'm a
You wanna
member of the
separate it?
elks. Oh, but I think it's fine for me to vote on it, I assume, Brian, but being a member, don't I have to disclose it? Yeah.
You're a member?
Are you a member?
No.
Oh, yes, I'm a member.
Nice. Okay.
I'm a member too, but I don't think it has anything to do with the others.
If there's nothing else for Harriet?
Well, our county attorney,
We're all set.
actually, Brian, don't we have to disclose we're a member before voting on something that involves money going to that entity?
Well, my understanding is that the disclosure is required. There can be no requirement that you accuse yourself.
Right. Right. So, I just wanted to make that clear.
Brian, while we have you on the floor, why don't we just take care of the one issue, the slight issue that we have with Countryside, the one resolution we have.
Thank you, Mr. Chairman. There was a resolution, there's been a resolution for a number of years to allow Countryside to contract with Mahoney Notifier for inspection did not include, and you compared it last time, did not include any service work that would be required. So we put ourselves in the, unenviable position of the guy in the commercial saying, I'm not a guard, I'm just a monitor. So I say there's a fire, but if it's broken, it wouldn't be able to do anything about it. So what we're seeking is an amendment of the resolution that will allow them to, enter into a contract that will include service as required under the prevailing wage schedule for that particular, item.
Okay, motion made by Supervisor Simpson, seconded by Supervisor Stroud. Discussion? All in favor?
Aye.
Opposed? Carried. Okay. Thank you, Brian. Okay, Pat, out there.
Where are your others? Right there now, where? Yeah.
Thank you.
Morning. I move a chair for it if I have to.
I have put the connection together. He met with us the other day about business we're doing. And, he thought, I'm like, wait a minute, did you write? Had no idea. Did we know that? I put it on
Morning. How are you?
Pat, we are ready, willing, and able when you are.
Oh, good, okay. Our agenda's changed a tiny bit from what was transmitted to you all last week. We have a couple of late-breaking things, but before we do that, I just wanted to introduce our new Assistant Director, who is Valerie Wisemount. Raise your hand, Val. Val's been with us for quite a long time, and we're happy to have her. She's been a staff nurse and a supervising nurse, and she knows everybody, and everybody knows her, and she's been welcome, and she's doing a good job. So I just wanted to...
Welcome aboard.
She's a little nervous about being here today, so everybody be really nice to her. Okay, moving back to, the additional agendas, we'd like to, have committee approval, if possible, to allow Robin Andre, who is our new supervising nurse, who's taken Val's place, to go to a new, supervisor training, at a cost of $179, and because it's over $100, we need committee approval for that.
Okay, motion made by Supervisor Simpson, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay, the next one is, a request that we have on behalf of, our other colleague departments, community services, and, employment and training. I see Chris and Rob are both here. We met with, the Assistant County Attorney a couple of days ago, and, we're looking to get a joint resolution so that we can have kind of one resolution that will allow us to participate, and allow receipt of district funds. And we all do our own projects, but you can see how it is specified. And, no cost to the county, it's just basically streamlining the process so that we don't have to do, one of the exact same thing for three different departments.
Okay, motion made by Supervisor Seaver, second by Supervisor Stroud. Any discussion on this? Rob, did you want to add anything, or you're okay with it? You were just here for questions?
If there were any questions.
Okay, super. Okay, all in favor?
I stay too, in case there are any questions.
Well,
The work that we're doing is stuff that we would do anyway. We're working with the committee on, what they call the Employment Engagement Committee. And, if someone needs to be reassigned because of changes in their job schedule, we're there to help them. And, I sit on the committee, so it's a little different from the health agency.
mm-hmm,
Still the same contract.
okay. We have a motion and a second, all in favor?
Aye.
Opposed? Carried. Okay, thank you, guys.
Okay, moving on to our regular budget, agenda, we'd like to request a resolution to amend the, county budget to reflect COLA payments for, the following programs. They're all listed on attachment 5. We don't need a resolution, to accept the funds, but we need one for, the budget to reflect the actual amounts.
Okay, motion made by Supervisor Simpson, seconded Supervisor McDevitt. Are we all good with this? Okay, all in favor?
Aye.
Opposed, carried.
And we would also like to request a budget transfer in the amount of $35,000 to cover the cost of per diem nurses who are being used to, fill our unfilled nursing positions. And again, just one budget amendment.
Okay. Motion made by Supervisor Strauss, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed, carried.
So we would, like to request a resolution to authorize a business associate agreement with Wendy Bassinger, who's an occupational therapist, to provide services in a form approved by the county attorney, and OT services are reimbursable.
To what extent? What percentage?
What percentage we pay, I don't know exactly, I guess we charge a fee, and the fee we charge is higher than what we would pay them.
Oh, okay, okay, good.
I don't know, Tammy, do you have an exact percentage?
Percentage difference, it varies depending upon, the different structures. What we find is, about, I figured out the percentage right now, about 15%, I think,
Okay.
that we have, the rate. Some of it varies, we don't always change our rates, every year to stay in line, but we do look at it every year, all of our rates, to see if we can,
Okay, I'm sorry, we do need a motion and a second on this, made by Supervisor Simpson and seconded by Supervisor Seaver. All in favor?
Aye.
Opposed, carried. Okay, thank you.
Okay, we would like to, discuss, receiving a resolution, approval for, to authorize Jody Brines, who is, one of our newer nurses, to enroll in the job-related course, which leadership and management for nurses. She's in the process, I believe she's only got 2 more courses before she finishes her bachelor's, and because she's new, she didn't realize that approval was supposed to be granted before the course started. The course has already started, but I told her we would bring it up and ask anyway, if, because she's new, they would pay for it. We have the, the funds available to do it, so it seems only right, given the fact that it's difficult to get nurses that fast.
Okay. Motion made by Supervisor Strauss, seconded by Supervisor Simpson. All in favor?
Aye.
Opposed, carried.
Okay, our next one, and sure probably people may have some questions regarding this. We'd like to increase our, rates for our therapists providing services, and we haven't, done anything with them since 2007, and to amend the business associate contracts. But what's happened is we've put it off pretty much as long as we can, and our competitive agencies are way, way higher than we are. They're paying, and so if the therapists have the opportunity to see patients from, another agency, they're gonna pick that over us. Plus the fact that it's really not cost effective for them to go, say, to Johnsburg for one patient, because we don't pay mileage and we just pay one fee. So it's just the way it is. And, we've been down, if you've been looking at our referral numbers, we've lost some referrals just by nature of the fact that if they have the opportunity to pick and choose, they're not gonna choose us. So we kinda need to do that.
So Patricia, this is a per visit, not a per hour thing,
It's a per visit, but the per visit includes travel time, includes documentation time. It's not, some places will pay per visit time and mileage, and we don't do that. This is, you do the visit, you do everything. You write it up, you drive there, it's, that kind of thing. So it sounds like it might be a lot of money, but it's really not when you figure that one visit could take 2 hours, 2.5. And if you gotta run up to Hague for one person, it's expensive.
So we have motion and a motion by Supervisor Strauss, seconded by Supervisor McDevitt. Is $75 enough?
Like 60, we have 2 regions. We have Region 1, which is down like Glens Falls, Lake George, but then if you go higher, the northern parts of the county, it's expensive.
Yeah.
So I think we need to do it, whether, we don't wanna price ourselves out of the market either, so that, we're losing money, but we don't wanna lose visits either, and some of these visits have nursing and therapy, so we would doubly lose, so we don't want that to happen either.
Supervisor Seaver?
Why don't we reimburse mileage? I mean, it seems like if you're going that far north, and by the time, like you said, by the time you're done, you're visit. I mean, really, when you're breaking it down, it's like $10 an hour.
Never have. We don't have, like I said, we don't have a huge number of people. I mean, obviously, the population density is down here. I guess maybe we're not asking to do that because it hasn't become a real problem. Is it going to next year? Maybe, I don't know, but right now, I think this is gonna go a long way. Todd,
No, I just wanted to say though, that as the therapist too, as a contract person, they can claim this mileage on their taxes.
Okay.
So even though they're not getting paid mileage, they keep track of the mileage and then they can claim it with their taxes.
Oh, good.
And I think a lot of it is for simplicity, because we have therapists, we do have some therapists that live, in outer regions. Some, we have a therapist that sees a lot of patients that actually live in Thai. But he will come down here and visit throughout the day here because he simply can see more patients at a per visit, rate. And again, it's kind of trying to find that happy medium. Our rates need to be competitive so that we can pay and continue to keep therapists, so that we can continue to keep the nursing part of the business, so that we can get all of the patients that need different disciplines in their care. On the flip side of that, we're not, we still have to, at least attempt to break even. So, it's trying to find that happy medium, and in talking with a couple of therapists, I think that this will be a kind of a nice compromise for them. And we do provide the laptop to them that they use out in the field. And we do that because I want to maintain the laptop. I want to make sure the security system is in place. I want to make sure all of those, that the data is encrypted and all of those things that we have to be very careful about, that it's maintained. So, I think that this is, in doing the analysis, I think we should.
Thank you.
Okay, we do have a motion and a second. All in favor?
Aye.
Opposed? Carried.
Okay, moving on, we'd like to request, to authorize a contract agreement with Lamar to purchase installing advertising wraps for our immunization program on the, Greater Glens Falls Transit buses for the month of August, at a cost of $1,522. This will be totally reimbursed by the immunization grant. And then, later on in the year, we're going to have, another month, but that one will be paid for by Washington County with their grant. But we decided rather than splitting the costs, we do it once and then they do it once. And again, it's part of the, we gotta get out there.
Good, I like that. Motion made by Supervisor Strauss, seconded by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried.
Okay, we would, for the people that, came to the tour last month, we, did give out a copy of our annual report, and I believe everybody that, had visited us before or wasn't at the tour got one as well, and, we need to, request a resolution to answer, number one, we wanna answer any questions that you might have, or if you have no questions, we need a resolution to approve it.
We don't have Supervisor Loeb here, so I think we're all set. The motion made by Supervisor Frazier, seconded by Supervisor Strauss. All in favor?
Aye.
Opposed? Carried. Thank you.
Okay, we don't have any pending items this month, so moving on for information for discussion. There's a copy of our monthly emergency response and preparedness activities report. Anybody has any questions on that? If not, we'll move on to the status of referrals, and, Tammy is now keeping track of that with so Tammy, do you have any comments? As you can see, we go up and we go down.
Well, that's basically it. I mean, we are looking at the 1 month that we were significantly lower. We did reach out to other agencies to see what they were seeing. And basically everybody was kind of the same way. We saw it a lot with our therapy. Well, I don't know if the orthopedics were the surgeries that we typically see where we were getting the aftercare or what, but everyone was seeing that. So, and then it kind of rebounded the following month. So it's something we certainly need to keep, now that we have competition, something certainly that we need to keep analyzing every month, but it's we seem to have rebounded. And right now at this point with our, and I think Pat can talk a little bit about our lack of nurses and trying to fill some of our vacancies, they're busy down here. So, I'm sure that, and the referrals keep coming in, and they like the fact that we continue to see patients, we'll open a case on the weekend, all of those things that we need to continue to do.
Supervisor McDevitt?
As far as the Zika virus, it's, a very
topical conversation today. I think on the news this morning, there was actually a professional golfer who opted not to travel to, I'm not sure exactly where, because of his concerns. So are we in good shape or not in good shape, or?
Well, I think right now we're saying that the mosquitoes that carry it are not in our county. Certainly that doesn't mean that they might travel with people or kind of migrate, from the south. We do have the cousin mosquitoes that are thought might be able to have it. As far as for most of us, if we're healthy, probably 1 in 5 actually get the symptoms from the Zika virus, which would be somewhat mild fever, rash, conjunctivitis or red eyes, usually seen within 2 weeks of travel to an infected place. What we've seen so far in the United States is really travelers bringing it back. And in our own county, what we've seen, as far as people that we've tested and so far been negative, have been people that have traveled that felt like maybe they wanted to start a family and wanted to confirm that they didn't have it. As far as right now, the biggest concern is these people that are childbearing age that are wanting to get pregnant, because not that they would suffer major illness, but because of the thought to happen to the fetus. There's a lot of concern. There's already a registry that's been set up in the United States to track births of women that have been exposed. There's protocols to closely monitor them with ultrasound. There's testing protocols. But the general recommendation for people traveling to Zika-infected areas is basically to abstain for 8 weeks from sexual intercourse, just to ensure that if they were infected and didn't know it, they're not going to pose a threat to a fetus. They know that it can be in the semen for maybe up to 6 months, so they're actually encouraging even pregnant women not to have sex with their partners if partners travel because of that concern. If there's been no symptoms, the recommendation is 2 months, and if there is concerns or symptoms, the recommendation is actually waiting up to 6 months to have unprotected sex with somebody that has been infected. So there's a lot of what we think and what we're doing to try to help the community, but as far as it kind of running rampant in Warren County, I don't think that that's the issue. I think the issue's with our travelers. Right now, we're not seeing a lot of person to person, which right now is supposed to be essentially transmitted.
Well, those cousin mosquitoes could be carriers.
True.
And those cousin mosquitoes are always a problem. No joke.
And there's a lot of lessons that we've learned from West Nile virus way back when. Actually, I was on a conference call this morning before here, where they're starting with the mosquito surveillance again in some of the bigger areas, just kind of monitoring for mosquito activity.
But again, the mosquitoes that carry the virus are still south of here.
Exactly.
You know, with the exception, I guess, of New York City with travel, you know, and such a focal point of human activity, it just, people traveling to South America or whatever, it just, I guess you can't be too vigilant in terms of trying to understand what's going on. And
one of the big recommendations actually for people that have traveled that think they might be sick with symptoms is actually to protect themselves from mosquito bites, just in case we do have mosquitoes that are capable of transmitting it. You don't want them getting bitten while they're sick to be able to then spread it within our community. So, you know, that's part of the education package if we were to have somebody that was positive, would be to educate them on preventing mosquito bites. That's kind of a big thing that bears watching. I think right now they're looking to try to put money into the situation, but they don't really know where to direct the money. And, you know, right now it might be prenatal and postpartum, you know, because that seems to be the area of the population getting hit the worst with the virus.
In our general public health works, talking about the reimbursement on general public health works grant, in recent fiscal, teleconference calls, now they want you to break out all of your time that you're spending specifically with Zika, and, which we're certainly rule followers, and we're keeping very good track of teleconference calls and things like that as part of our emergency preparedness, for just that reason, because they do anticipate there will be a funding stream. I mean, right now, we cover everything under our general public health list, but they do anticipate if there is an emergency declared, that there will be additional
Supervisor Montez?
Pat Hauer, I'm just curious, we've always had a very positive revenue flow from this department. In the past few years, it's gone down, and that's not a criticism. But I was just curious, is it the number of competitors, or is it the price that competitors are doing? What's causing that difference?
Certainly the competition has an impact. We expected there to be an impact, but there is also, the fact that like Medicare isn't paying as much per visit, Medicaid isn't paying as much per visit, so that alone is gonna do it. Insurances, there's a lot of managed care, so we're dealing with a middleman. Middleman gets a little bit of money, so we don't get quite as much money. So we're still doing what we do, it's just that our payment sources, through no fault of ours, have changed.
Okay, and so, what's made competition jump into that though?
The New York State Department of Health, offered up the opportunity to have other agencies, submit certificate of need. And they were approved. It's just the way, we were really lucky for a really long time that we didn't have any competition.
Kinda like an unfunded mandate, huh?
Yeah. Well, the other thing.
When managed long-term care went into play, New York State required that that a patient has choice. With one person, there's no choice. So that's why they chose to move, despite the fact that we were able to serve the population, they had to have a choice.
And of course, our costs are a little more because we're, as you pointed out, the population density is here. Some of those services don't go to Hague or.
Right, well, the competition don't want the outlier people. They want to just take all of Queensberry and Glens Falls and nothing else. But, one of the reasons we've always felt strongly is if you live in Warren County, you should deserve to be able to be served in a timely manner. So I don't have an answer except that we're not doing anything differently except that payment sources have changed. That's good. Dawn? More of the same?
More of the same. Okay, regarding our, revenues and expenses, year-to-date, I just wanna add, this was all printed before, we just closed the month of May and close to $300,000 more revenue was posted, to our numbers. You'll see though, regarding our payroll, we like to keep track of that. We, as you see, because of our full-time nurses, we just still have some positions open, but we are utilizing the part-time salary line for per diem. Overall, we're down 7.49% compared to last year at this time. So, also, as you were stating about the revenues are down, our expenses are down too, because our nurses, of course, we have some positions right now. We are using the per diem, which saves on some fringe right now, and we're lucky that we have a great per diem pool. The other thing I wanted to point out to you on attachment 2 was the 2015 prior years, which we haven't really discussed because we were waiting for books to close. I just want to bring to your attention, we had budgeted $2.2 million impact on the bottom line, and we came in over just a little over $2 million. So it was over $160,000 we came under the budget last year overall. And that's looking at all our departments, which is like 12 different departments within our agency. So we did come in, and we did the year before, I believe, too, come in under budget, which was good. That's my bottom line, is as long as we don't cost the county money, we cost them what we budgeted or less, which we did. On attachment number 3 is our comparison last year to this year, which you will see that revenues are down and expenses are down. Usually there's a correlation, and I've always said that if our expenses are down, usually our revenues are down, and we've proven that. Basically, one thing that's been a big impact for this year is our long-term care program is no longer. Our last patient, I think, was at the end of May, or first in June, so that program was it June?
30th May.
Oh, 30th May, okay. And so we're still billing revenue from stuff that's going on, and we're working on that AR, but that program, as it is no longer. So when you compare it to last year, that's gonna be the big difference right there with that. Also, our preschool and our early intervention programs, again, they're based on when the state, asks us or tells us when we can submit stuff, and again, it's due to some timing with that. So those 3 things right there have impacted right now, year-to-date from last year. Other than that, it's staying as is. There really isn't anything else new, like she said, just we see that with the competition. One thing I just wanted to add was that we service Warren County only. The competitors do Warren and Washington, some Saratoga, so when they've come in, they're a little bit sparse and they may get some of ours, but we only do Warren County. So we're glad to say that we service our constituents in this area, so. Anyone have any questions?
Anything else, Bob?
No, I just wanted to give you a little quick update on our, personnel situation. Our nursing recruitment continues to be a challenge, because we're all drawing on the same, every agency is looking for nurses. And as you see, we have got one new nurse, and since last month, one resigned for personal reasons and one resigned for retirement. And, the one that, both of them are gonna stay per diem, and that really right now is, it's a savior, because they're already oriented, they wanna work, and they're older, they don't wanna work in full-time status, but they're happy to work like 3 days, and helping, when we raise the rates for the weekend, that's helped a real lot, and it's helping our full-time people, so they don't have to work as often. So that part is good, but we're still looking for nurses. Again, we have to have some with some experience just by nature of the job, but we're doing okay, and we only fill positions when we need them. So,
Very good. See, Valerie, that wasn't that bad. Okay, we need a motion to adjourn then. Made by Supervisor Simpson, seconded by Supervisor Stroud. All in favor? Opposed, carried. Thank you very much.